to breakout or breakout three. I'm going to do some introductions for our speakers for this session. We have Alejandra Rivas Deras. She is a rising fourth year medical student at the David Geffen School of Medicine at UCLA. She's enrolled in the Prime Leadership and Advocacy Program. And as the child, as a, through her experiences as a child in a Latino community, she witnessed firsthand, the difficulties and barriers that her community faced in accessing health and social services. And this experience, in her words, drives her to the commitment of health equity. And Alejandra aims to equip her community with the tools needed to protect their health as she continues her journey to becoming a socially conscious physician. And we also have Leslie Nunez. She is completing her master's year in the Prime LA program at UCLA. Ms. Nunez was raised in Southeast Los Angeles, surrounded by resilient and hardworking individuals who often felt abandoned by the very healthcare system meant to support them. As a future internal medicine physician, and through her work with La Cosecha, she is committed to bridging that gap, bringing compassionate care, advocating for underserved communities, and equipping them with the knowledge and tools to take charge of their health. Please welcome our speakers. Thank you.
Thank you, Diego, for that beautiful introduction. So we'll go ahead and get started. If we can work this. So if you haven't already, if you can take a moment to complete the pre-test while we get started. I'm just going to ask a couple questions just to get us warmed up. How many of you have had strawberries this week for breakfast or maybe lunch? Okay. What about lettuce? For a salad, we literally just had some, right? And so I want to highlight that just to give you some cool facts about California. So actually, a third of the produce that's produced, or vegetables produced for the nation, is grown here in California. And 3/4 of fruits and nuts are actually produced here in California as well, which kind of shows you that our farm working community who produces and grows and picks all those foods that we eat without even giving a second thought sometimes about who did that for us, right? Who got that for us? And so we want to highlight the value and how it's our responsibility to take care of our farm working community. And so again, as mentioned, my name is Leslie.
Name is Alejandra.
And we're both community health education chairs from La Cosecha. La Cosecha is a student organization that was created by two of our dear friends, Erica and Denise, who would have loved to be here, but actually there's a La Cosecha event happening today. And both of them are proud daughters of immigrants. We are all medical students, and they identified a need for increased awareness of how we can serve and best care for our farm working community. And so they started this organization aimed to provide resources, health education for this community, as well as for those who are intending to care for them, as us aspiring medical students and you all as community members in the work that you do. And so unfortunately, these videos can't be played today, but the top video is actually Denise's father working, picking fruits. She grew up picking fruits in a small town in Northern California. And then Erica's parents also picked fruits and vegetables. There's a picture of them working at night. So some produce has to be picked at night. And so that obviously adds a couple of extra risk factors. There can be accidents and there can be issues. And so we really just want to highlight how important and how this work is in really spreading awareness for our farm working community. So that's the picture. And so we would not be here today without the community that's taught us a lot. Alejandra and I actually don't come from a farm working community, and we acknowledge that. And so we've learned a lot from these presentations that similar to this one that we've delivered out in the community in Oxnard, for example. And so we just want to acknowledge the community members who allowed us to be here today. So we'll go ahead and move on to this quote. Can we get a brave volunteer to read this out loud? Thanks for reading that, Hera. And these numbers are quite high, and unfortunately, they demonstrate an underestimate of the amount of fatalities related to heat. There are many factors that go into the fact that these are an underestimation. Sometimes folks are afraid to report. Sometimes they are unaware that these are things that can be reported. And even as healthcare professionals, sometimes these deaths are not registered to heat illness as well. So we just kind of wanted to share how striking these numbers are and why this kind of education for all of us is important.
Okay. And so why is it important that we talk about heat illness and just being able to identify the stages and respond and manage it? Well, across the literature, we've seen that temperatures are actually expected to increase as a result of climate change. As of right now, farm workers are exposed to approximately 21 unsafe working days during the summer harvest. So this would be between the months of May and September. And this is a number that's expected to double by the middle of the century and triple by the end of it. So we're already starting to see some of the effects of these climate changes, and we're already experiencing ourselves, right? Some of these hotter temperatures. In fact, one study that looked at some of the national heat illness mortality rates reported that some of the highest reported deaths occurred in 2023, and that is a total of 2,325. And again, how Leslie mentioned, this is likely an underreporting because a lot of cases don't go reported. Of note, this year also had one of the planet's hottest day on record reported. So again, we're starting to see these changes, right? And so all of this is important when we consider that the agricultural community has been recognized as a particularly vulnerable group for heat illnesses, and they're at a greater risk to experience adverse health effects from heat illness. In fact, they have a 35-fold increase in heat-related mortality compared to other industries. And so that should tell us about some of the extreme conditions that they're working under, right? And so this is important. Let's consider why this is a particularly vulnerable group. Why are they at greater risks, right? Well, to begin with, they're working in very extreme hot temperatures, which often exceed the international standard. Apart from that, right, it's a physically demanding job. So they're constantly working hard all day, sometimes at night as well. And that puts a lot of stress on the body and increases the metabolic rate. Another thing that contributes to the increased risk is the fact that they get paid by the piece. And in short, this basically means that the amount of money that they're able to make after every shift is directly correlated to how much they can collect or harvest during that shift. And so this creates a culture where people, don't really want to take breaks or rest and hydrate because it directly impacts how much money they're making during that shift. And of course, folks have families to feed, right? People have responsibilities. And it's kind of difficult to ask them to do that, even though it will positively impact their health. Additionally, it's important to recognize that there is lack of oversight from certain regulating bodies, such as OSHA, the Occupational Safety and Health Administration. And so if folks are not aware of their rights in the workplace, if they're not aware of how heat illness and the work that they do impacts their health, or if they're just afraid to report certain unsafe working conditions because they're afraid of retaliation, then nothing will essentially get done about it, right? Because nobody's there day after day making sure that their rights are being protected.
So now we're going to be talking about the spectrum of heat illness. And today, during some of the workshops you attended, you got a little bit of a preview of what heat illness is and this spectrum. And we took the liberty of including some of the words translated in Spanish, so rash, sarpullido, heat cramps, calambres de calor, because a lot of the community that we work with is actually Spanish speaking. And that's not to say that our farm working community only speaks Spanish, right? We recognize that we need to have all this information available in multiple languages, and different communities, again, have different needs and different cultural practices. And you'll see here that we address some of the common misconceptions, but common beliefs as well that come within our culture. Both Alejandra and I identify as Latina, and so we'll talk about some of the misconceptions that we've come across in our community. And really, it's an opportunity for education and dialogue, both for us to learn and the community to learn as well. And so as you may have heard earlier today, exposure to heat and other factors like humidity, the kind of work that you're doing can exacerbate heat illness, and either of these on the spectrum. You're going to hear us talk about each of these stages, the signs and symptoms, and how to recognize it so that we don't get to the end of the spectrum, which is heat stroke. And our bodies have natural ways of cooling down, like sweating, vasodilation, to kind of help get rid of that heat. But when that's not enough, when temperatures are in the hundreds, 110s even, then our bodies can no longer tolerate that heat, and that's how we move further along in the spectrum.
Okay, so we've arrived at our first stage of heat illness, which is heat rash, or in the community's term, sarpullido. Sarpullido is essentially a rash that forms as clusters and bumps on the skin that can sometimes be itchy or uncomfortable, and it most often appears in areas of the body that tend to retain more heat, so maybe the neck, the chest, under the breasts, the inguinal areas, the axillary areas, and often we tell people that yes, although sarpullido or heat rash is a milder symptom of heat illness, it's still our body's way of telling us that, hey, we're warm, right? We need to start cooling down because we're starting to feel the effects of heat illness. And some folks do say that they recognize sarpullido as a heat illness kind of spectrum, and some don't. So it's always important to kind of address even the milder symptoms so that folks can start recognizing and start mobilizing a little bit more to cool their bodies down. So we always recommend folks to move to cooler areas, possibly if there's shade, right? Be drinking water continuously, start taking those breaks to rest, to make sure the body's resting. On top of that, the most important thing that we highlight for this stage of heat illness is keeping the area dry. They could use like talcum powders or powders for symptom relief, but ultimately what's going to lead to the healing of the rash is going to be keeping it dry and making sure that the area is breathing, right? And so, like Leslie mentioned, we acknowledge our proximity to the community. We know that we don't know everything, and so we really encourage folks when giving this presentation. We encourage folks to have a conversation with us, right? We're not just kind of giving them information and numbers and statistics. We really ask them, like, what are your current practices? What do you currently do to protect yourself from some of these symptoms of heat illness? And they're always happy to share their stories, especially when we show vulnerability, right? And we explain to them, we are here to learn as much as you guys. We want to make sure that we become better physicians and more socially conscious physicians so that we can properly take care of you. And so when you express that vulnerability and you show that side, folks are generally receptive to having those conversations, and we learn, right? So like Leslie said, folks put pomadas, which are like thick lotions on the skin sometimes when they see a heat rash. And so that offers a window of opportunity to kind of explain, hey, that pomada might actually retain moisture, and that will further irritate the skin, and then just could possibly lead to worsening of the symptoms or to a serious skin infection, right? And so that's kind of how we approach our presentations, and generally they've worked out, and we've learned so much.
Also, it's important to highlight that heat rash, sarpullido, presents different in different skin tones. So having pictures that show there's a big difference in these skin tones, how heat rash appears. And so we want to highlight that as well. The next stage of heat illness are heat cramps. Typically, these occur in large muscle groups like our abdomen, our arms, our legs. And we recommend, of course, our recommendations sometimes come with caveats that it's not always going to be possible to take a rest or to go to a shaded area, and we get that. We want to just share this information so that it's in the back of their minds and they're able to pursue these practices if possible. We want to highlight that if these cramps do not subside within an hour, we might be further along in the spectrum of heat illness, and you'll see once we get there. But again, highlighting that these are little ways or big ways that our body is letting us know that we're going into overdrive and the heat is kind of taking over.
And it's actually pretty astonishing how often we learn that folks do experience some of these symptoms, but just continue to work through the pain because they just think like, oh, it'll go away, like I can power through it. And a lot of that is a conversation, right? Just making sure they know what is causing these heat cramps and like just giving recommendations that they might be able to do is kind of the goal. Now we're at heat exhaustion, and this is what we call the point of no return. And I know it sounds morbid, but basically what we mean by that is that whereas previously with sarpullido or with the heat cramps, you can kind of rest, wait a couple of hours, and if the symptoms subside, then you can return to work. At this point, once you've reached heat exhaustion, we recommend that you actually don't return to work, right? And that you actually go seek medical attention and talk to your physician and let them know, what is your occupation, what are your risk factors, so that they can start documenting your risk factors and they could be aware of what to look for in the future if things were ever worse. But we do recommend getting a medical attention at this point. Additionally, previously for the more milder symptoms, we're focusing on passive cooling of the body, right? Maybe taking off some layers of clothing, drinking water, rest like shady areas. At this point, we really want to start more active processes of cooling. So putting maybe cold compresses or ice water bottles in the areas that tend to retain more heat. So like in the inguinal area, under the axillas, just to kind of help the body's normal processes of cooling down. And at this point, we do inform folks some of the symptoms that you may experience are just like your body's normal mechanism, like sweating profusely, right? Maybe feeling thirsty, feeling irritated, dizziness, abdominal pain. You're not going to feel well. And so these are signs that your body's giving you to start seeking that medical attention. Additionally, delegating tasks, right? Making sure someone's informing the supervisor, somebody's calling 911 if necessary, and someone is staying with the person who is ill, because clinical deterioration can happen very quickly, right? Maybe 1 second they're not as bad, but the next second they can be further along in the heat illness spectrum. And so having someone always with the person at all times is very important at this point.
The next stage of our heat illness spectrum is rhabdomyolysis. Do we want to try saying it out loud? Rhabdomyolysis. Try saying that in Spanish multiple times. It's so difficult. But really, it's just a medical term to describe muscle breakdown. And this happens when you're working extra hard, you're putting in work, le estamos echando ganas, the sun is out, it's really hot, and our muscles start to deteriorate. Why is this dangerous? Well, when muscle breaks down, it actually releases proteins and electrolytes that can be harmful. It can cause arrhythmias, meaning our heart can go into weird beats and actually stop when electrolytes are all over the place, as well as these proteins can get stuck in our kidneys and cause injury. And so remember, we talked about muscle cramps. If those are not going away after an hour, that actually may be a sign that we are in this stage of rhabdomyolysis. And so some of these symptoms will be muscle cramps, again, that last over an hour. One sign to look at is urine. So if you are experiencing rhabdomyolysis and you urine and you go urinate, the color of your urine is going to be the color of Coca-Cola. So that's basically black, right? And so that's not normal. And that's a sign that our bodies are in this stage of heat illness. In terms of management, we want to stop all the work, as Alejandra mentioned, starting with heat exhaustion. They're moving forward on the spectrum. We want to seek medical attention. A lot of the therapy for rhabdomyolysis is continuous fluids in order to kind of get rid of those electrolytes and proteins. And actually, when we provided this similar survey the similar presentation and survey, a lot of our community members didn't know that rhabdomyolysis was part of the heat illness spectrum. And actually, we saw a 40% increase in that awareness once we delivered that conversation and that discussion. And so just something to keep in mind, that our bodies are giving us signs throughout this spectrum, and that we need to learn how to pay attention to, and that we are hoping to communicate that with our community members as well.
Okay, and so now we have arrived at our final and most dangerous stage of heat illness, which is heat stroke. And so at this point, right, our body's natural thermoregulatory processes have failed. Our bodies can no longer alleviate that heat stress, and our core temperatures can actually rise to as high as 106 degrees or higher within 10 to 15 minutes, which is kind of why we say, like, never leave somebody alone, because everything can change in just a couple of minutes. And so at this point, you start seeing more severe symptoms and neurological symptoms. So you can possibly be confused, you can collapse, you can have seizures. And at this point, it's very, very serious. And we definitely recommend calling 911 at this point. And just some of the similar steps that we have previously outlined, just from heat exhaustion forward, apply here as well. With the additional recommendation that oftentimes when we see someone who is, in desperate need of help and kind of in an emergency, our first reaction is to run to the person and huddle around them and see how we could be of use, right? And so one thing that we really highlight to folks is that although that is our natural instinct, and although we do recommend staying by the person's side, make sure that you're giving them room to breathe, right? And make sure that they have, you allow for that, like, airflow to make sure that we're supporting their body's own way of cooling down and just allowing that air to circulate. So that's the only change that we have here, but we're calling 911 and making sure that we're delegating those tasks, right? To make sure that things get done, because it is an emergency.
So we talked a little bit about rhabdomyolysis being a cause of kidney injury, but that's kind of further along in our heat illness spectrum. And it's important to recognize that dehydration over and over again, every day, day in and day out, can actually cause kidney injury. And that's because when we're dehydrated, there's not enough blood flow, enough perfusion to our kidneys, and in the long run, that can lead to kidney injury on a daily basis that ultimately will lead to kind of chronic kidney disease. And so in a study of 193 farm workers in Florida, they found that actually 53% of farm workers started their day dehydrated. They're already starting dehydrated and they haven't even worked yet. And how they did this, how they studied this, was looking at the urine and how concentrated it was. And so there's a specific metric that they look at. And if it was extra concentrated, that was a sign to them that the farm worker was dehydrated. And so 53% of them started dehydrated. After a day of work, actually that increased to 81%. So 81% showed signs of dehydration, meaning at risk of kidney injury. And so what this tells us is that we need to enforce hydration not only in the field when folks are working, but also at home. We have to stay hydrated today in order to be ready for tomorrow. Because again, we're seeing that folks were starting off dehydrated. And so continuing that encouragement of drinking water. And so in the fields, when we're providing advice to our community members, we want it to be relatable. We want it to be applicable. And so in the fields, farm workers oftentimes have stations with cones that you can see there, just kind of cones to drink their water. And so using that as a metric, the recommendation is having 16 cones per hour. And so that's kind of the advice that we give. Some people may need more, some people may need less, but that's kind of a good baseline to start off with. Something else, again, our bodies are experts in themselves. And so we really want to encourage our farm working community and us ourselves too, to look at the color of your urine. If it's extra yellow, extra smellier, that's a sign that you're dehydrated. And so we want to equip our community members to look at these things and use that as a form of guidance to try and increase water and fluid intake. One misconception that came up in these conversations was that if I drink cold water and it's really hot outside, I'm going to get mouth blisters. And that's something that we had to engage in a conversation with and let folks know that actually that's coming from the heat illness, not from drinking the cold water. And it's important to drink if it's cold, even better, because that's going to refresh you in that moment. But again, these are conversations that are ongoing with our community.
And so how Leslie mentioned, right, she gave us the definition of AKI, and then the study that she mentioned showed that 53% of folks at baseline are starting their shifts at a deficit. And another study of farm workers actually showed that approximately 15% of people had evidence of an AKI after just one shift during the summer harvest. And again, some things that contribute to some folks being dehydrated and just getting these AKI, acute kidney injuries, but AKI for short, is, you know, the physical demand on their bodies, working in extreme temperatures, moisture, if there's moisture that day, and then just maybe like a social component as well, right? If you're working in teams, sometimes nobody wants to take a break. Everybody wants to make sure that they're doing their part so that everybody can take a good day's pay home. And so we really want to emphasize that this puts folks into this vicious cycle of chronic dehydration. And that is equivalent to daily AKIs or acute kidney injuries over the long run. This is going to have cumulative effects, right? This chronic state of dehydration down the line is going to lead to folks developing chronic kidney disease. And something interesting that we learned when developing this presentation is that of the folks who develop chronic kidney disease from chronic dehydration, the folks who tend to be most affected are young farm working men between the ages of 25 to 35, who of note do not have any chronic conditions, right? Like diabetes, hypertension, obesity. They don't have any of these things, but yet they're the most affected demographic within this population. And so often what ends up happening is that these cases of chronic kidney disease end up going diagnosed as chronic kidney disease of unknown origin. When in reality, we know that heat exposure, right, is the underlying cause, and then the chronic dehydration that it causes. And so I think this is it, but because folks lack the typical predisposition, that's why they're going misdiagnosed. And so I think there's a couple of learning points here for the community, but also for us as well as aspiring physicians or health professionals. So number one, we do encourage folks, again, talk to your providers, let them know what your risk factors are, what your occupation is, because that's going to enable them to, or support them in supporting you in the future, right? Being able to better take care of you depending on your specific risk factors. Additionally, we also really try to make sure that folks understand the relationship between hydration and kidney health, because that's the only way that folks are going to be able to really protect their kidneys and avoid going down the long journey of chronic kidney disease and its management, which we will touch base on. And lastly, for us as health medical students, residents, attendings, anybody who's aspiring to a career in the health field, right? When we're creating our differential diagnoses, we want to make sure that we're looking at the entire clinical picture, yes, but also take into account the social context of people, right? Such as their occupation and their personal risk factors when determining what's causing their medical condition.
So chronic kidney disease in the long term leads to dialysis. Needing dialysis means that you need treatment so that the job of the kidneys is done for you. How many of you went to the other nephrologist talk of dialysis? I think I see some familiar faces. Yeah, so that was a great introduction to kind of talk about this, specifically within our undocumented immigrant community. So often, our undocumented immigrant community has not had access to health insurance like Medicare, Medi-Cal, and even the Affordable Care Act. And so many of our undocumented individuals who need dialysis find themselves having to go to the emergency room to receive care and receive this life-sustaining treatment, which is dialysis. And here they're able to get the care that they need through EMTALA, which is the Emergency Medical Treatment and Labor Act, meaning that no one can be refused care if it's an emergent need. What this means is that people have to go to the emergency room basically at the edge of dying. in order to get the care that they need. And so this is the story of Lucia. It's a short video, which won't be playing here today, but her story was told in 2018 on CNN, and she lives in Colorado, and she knows this story too well. She knows that if she goes to the emergency room too early, she's going to be turned away. But if she comes too late in the game where her electrolytes are all over the place, she might find herself having to be resuscitated because her heart has now stopped. And so she lives her life worrying about how much she can eat. You know, you and I, we presumably can eat, you know, fruits, vegetables, drink as much water as we want, knowing that our kidneys will filter and we're okay. But for her, if she drinks too much water, that might send her to the hospital sooner than she might have expected. And so this also comes into play because oftentimes after years and years of dialysis, the next step is kidney transplant. And that's also an issue for our undocumented immigrant community. And so transplants are managed very differently state by state. At this time, only about 5 states offer statewide transplant healthcare coverage. And for those of you who may be in the healthcare field, know that it's such a vulnerable process. You have to go to appointments. You need to be on immunosuppressants so you don't reject this kidney. But it's important to highlight the health inequities within this process because in 2012 and from 2012 to 2013, UNOS and the transplant organizations demonstrated that only 1% of folks who are undocumented or are not citizens received organ transplants compared to the 10% that they donate. And so see that disparity there. And so we want to kind of bring awareness to this so that we all can keep that in mind when we're serving our undocumented immigrant community.
And just like a couple more, just to add a little bit more context, maybe for some of us who don't have like a medical background or just in case you missed it in the previous presentation, the current standard care for people with end-stage renal disease who are on dialysis is actually 4-hour-long sessions for approximately 3 times a week. Right? And so that is the standard of care to do it properly. Sometimes undocumented folks are waiting between 6 to 7 days for their next dialysis appointment in the emergency department. And so again, it highlights the inequity, right, that exists in the type of care that people receive. And this model it's not sustainable in the long run. It does encompass greater suffering for both the patients and their loved ones, as well as for medical professionals, right, who do face this moral injury in providing this type of fragmented care, because it's not a solution. It's kind of a band-aid fix, and you're going to probably be seeing folks again the following week. And so there is that moral injury that providers will experience as well. It's more expensive to keep this model of emergency-only dialysis, right? The American Journal of Kidney Disease estimates that we spend annually about $400,000 per person on emergency dialysis, compared to less than $100,000 for someone who's on the standard regimen for care. And additionally, it does come with more complications for folks who are waiting until they're on the brink of death, essentially, to receive this type of care. With folks who are on emergency dialysis having a 5-year mortality risk 14-fold higher than those on the standard regimen of care for dialysis. And so this is important, again, because this just to highlight the fact that the current model that we have is not sustainable. And some states have made some strides in the right direction, right? There are certain states like New York and here in California where we've passed legislation that acknowledges outpatient dialysis as life-sustaining treatment. And this enables them to use emergency Medicaid funding as a way to kind of fund that outpatient dialysis. Additionally, as of January 1st, 2024, there was the final rollout of the medical expansions, which enabled undocumented folks between the ages of 26 and 49 to be able to receive full coverage, which would have supported, funding for their dialysis treatment and probably transplant care, post-transplant care. And so this really highlights that this is an area that is in dire need of advocacy, both to protect the current funding the current coverage that people have in terms of health insurance, but also to advocate for more coverage, because it does vary across states, right? Not every state is like California. And it's really up to the state to decide what kind of coverage they provide. And so again, the preventative strategies are going to be very important, right? That's why we administer the pre-surveys, the post-surveys, just to kind of make sure that we're really driving the points home, like the folks' confidence to be able to respond to heat illness, people being able to identify the kidney, right, as the organ most affected by dehydration, which we saw like 40% increase. That's really the goal of our health presentations, and we really try to drive those points home.
So a big part of our conversations with community members is how do we prevent heat illness? How do we make sure we don't get on the spectrum at all? And so we have a big portion of our conversation focused on encouraging community members to identify the risk factors that put them at a higher risk for heat illness. And these are divided into 3 categories, as you can see here: personal, work, and weather. So for personal, chronic diseases like diabetes, using certain medications can put you at risk for developing a heat illness. In terms of work-related risk factors, if you're working next to machinery that's hot, that's of course adding increased temperatures around you. If you're using personal protective equipment that's heavy and hot, that's obviously going to put you at higher risk as well. That's not to say that we shouldn't use personal protective equipment, but it's really an opportunity for us to encourage our farm working community that during their breaks, it's important to remove that in order to allow your body to cool down, at least for that short amount of time. And then in terms of weather-related risk factors, things like humidity do impair your own body's ability to get rid of that heat. Here are others that you can kind of see there.
And so clothing, the type of clothing that people could wear, should wear, was a topic of conversation all in its own. But I guess just to keep it brief, we really encourage folks to, although we can't control the weather, looking ahead of time and preparing for the next day is important, right? If it's going to be hot in the morning, cold in the morning, hot in the afternoon, right? Layer up, maybe remove those layers. Wear clothes that provides the maximum amount of coverage for your body from the sun. But also that is light colored, breathable, right? It's fitted, so it's not snagging on branches or any machinery, because we do want to keep safety in mind. If you look down here to our, I guess to your left, my right, you can see a picture of some of the hats that we distributed that we do distribute at some of our events. And if you notice, right, they have a wide base to provide the maximum amount of coverage from the sun. And the fabric is a lot more breathable than baseball caps, for example. They also come with shields, right, that also protect from the sun and from dust particles from reaching the face. Here, it's important to talk to community members about what they currently do, because some folks express that they put bandanas under their baseball caps. And then they put bandanas on their face to kind of shield themselves. And that fabric is a lot thicker. And so those kind of things kind of prevent our body's own cooling processes. So again, opportunities to just address misconceptions and engage in conversation. And generally, we've been well received by the community, thankfully, and we learn and they learn as well. And I think Leslie was trying to show you guys some of the hats. We have a volunteer. He just chose one. So here's our model right here. He's doing a great job. Yeah, so is it breathable? Yeah, okay. Is it comfortable? Okay, great. So these are the type of things that we try to come in with tangibles for the community, right? If we're asking them to sit through our presentation and listen to our information, we also want to make sure we provide folks with things that they can take home and protect themselves as well.
And we're kind of at the end of time now. We have Diego, our time tracker here, giving us some looks. So we're going to end, I'm just kidding. We're going to end our talk here. But if you have any questions, we're happy to answer them and kind of share some more of our experiences working with the community. But thank you all for having us here today.
All right, they're taking it from me. I'm going to keep it. All right. I think we do have about 10 minutes left for questions. So I see one hand up right there.
Thank you. That was a very good presentation. Thank you. So I wondered, you had listed salt tabs. Is that like something that is a misconception that you know of, that people will use salt tabs and they really shouldn't?
Yeah, definitely. Thanks for the question. Sometimes salt tabs can be sold over the counter, and oftentimes folks feel that that may be a quick way to help them feel better, but actually may exacerbate those electrolyte derangements that can land them in the hospital. So yes, it is a misconception to have those salt tabs in kind of state of feeling ill. We also are going to pass these around. So these are kind of badge buddies that we created for the farm working community that we can distribute. It basically has our presentation summed up into one card that they can carry around with them. We have another talk about pesticide exposures that they can read about as well. And then in light of all of the immigration raids happening, we've also provided red cards for our community members to have accessible to them.
Do we have any more questions?
Great presentation, guys. You mentioned about disseminating disinformation to individuals, especially those who are most vulnerable. How do you manage that given the threats from ICE raids in these communities? We found that at least here UCSD has been challenging to engage with those communities because they're just so concerned about potentially being in one particular place and then getting picked up. Have you encountered those issues, and how do you overcome that?
Yeah, we actually have encountered that a lot. I think everybody's feeling that the weight of that and that pressure right now. We actually had to move one of our events back in March, just because we weren't sure that it was the safest thing to do to ask folks to come out and be exposed in the open and listen to our presentation. So that had been a problem, but I think that ways that we've prepared ourselves to kind of engage or do the respond, right, is we've thankfully our presidents have brought in like attorneys to kind of educate us on how to properly respond if in the event that we are in the community doing our health fair. If ICE were to show up, what would be the appropriate protocol? Like, what do we recommend folks to do, just so that we weren't caught off guard? And then we do partner with like a bigger organization, Celebration Nation, who invite us into their spaces. They're doing food drives, right? And so even though there are the raids going on, people are still showing up because there's a need for food insecurity or just school supplies, things that folks in the community need. And so when they show up, we show up, right? And we just adjust our health education materials. We go car to car sometimes while they wait in their car and load them up with groceries. So part of that is just, joining the efforts and helping wherever we can and really just tailoring our presentation to the need of the community.
Just to say that it's not perfect, we're adjusting as well along with everybody. And like Alejandra was mentioning, typically the way that our community events are structured is that Celebration Nation will have a drive of food, groceries for our farm working community, and then we're kind of set off to the side where we bring in practicing physicians to have, like, this may be the first time one of our farm working members is talking to a physician. So we want to bring that there. We have blood pressure checks as well as blood sugar checks. And then this health education curriculum to the side, as well as goodies. We want to have something to give to our community members, like those hats that you saw, sunscreen, sometimes, handouts as well, those badge buddies that you saw. So we try and bring something along with us. For our talk on pesticide exposures, we got donations for detergents so that we could bring that and kind of encourage folks with the washing of their clothing in order to get rid of that pesticide. But we're learning and we're adapting with the times as well.
Hi, thanks for presenting. I just had a quick question about if you guys had any mechanism for following up with the farm workers, like if they were like taking your guys' suggestions for the long term.
It's a great question. Actually, we run into a lot of the same folks at these events, and so that's kind of a way that we try and touch base and see how things are going. I think in the moment we're trying to figure out a safe way to keep all that information stored. Right now, our forms are anonymous so that we can just track the progression and the learning. But that's something that we are working on, trying to figure out how we can best reconnect. At this time, in the Badge Buddy, you'll see that we do have a website that we can see how many clicks it has had to kind of see that engagement. Although we recognize that technology is obviously a great resource, but also a barrier for some individuals. And then something else, in that drive we just had, we collected names and phone numbers to reach out to community members and see how we can deliver our backpacks and our school supplies for the coming year. So that's something else that we're trying to target as well with health education, but college fairs as well.
I just wondered, like, in terms of, well, a couple of things. Do you also address pesticides too? Okay. What counties do you cover? Just where you are physically?
In terms of the community we serve, we mostly we're in the LA area, but we travel up to Oxnard, and typically just the community that's surrounding there that comes to the food drives. We are exploring ways that we can kind of increase the population that we see, but we're learning how to do that as a student-run organization. We've gone to events in the Coachella Valley. Have you all heard of Coachella, like the festival? So there's alongside that, there's something called Farmchella. It's for the farm working community, just to kind of provide them with resources and a health fair during the time where a lot of community members are coming from the outside and maybe not necessarily keeping the community that already lives there in mind. So that event is held for them.
Yeah, I just kind of think it's needed.
Yeah,
so many places like Central Valley, Modesto, down the coast where all our farm workers are. And then the risks of pesticide exposure. I'm actually with a group, California Pesticide Reform, and they do a lot just working with the communities to use their voice. But I was just thinking when you were talking about dialysis, I mean, just the significance of tracking the costs of that care being delivered in the ED. I mean, dialysis is not an inexpensive treatment. I mean, and again, the 5-year life expectancy, this is very drastic, to have people develop chronic kidney conditions.
All right, thank you everyone for the questions. I'm gonna check out what's going to transition into. Yeah, another round of applause, please.
While we wait for our next presenter, if you can take a quick moment to fill out the post test. So this will kind of tell us how good of a job we did in providing this health education information, and we'd really appreciate that feedback. Thank you. Yeah, so that varies. We didn't touch on because we ran out of time, but it could be anywhere between 4 and 14 days. The reason why that range is so wide is because everyone has different needs. But we do emphasize that during this period, which takes place at the beginning of each harvest, right? When folks haven't worked, they're not used to it. And so we need that period of getting used to the work environment. And during this period, folks are actually at a greater risk of experiencing acute illness, and actually those are when most of the cases occur. So we do highlight that at the beginning of the harvest, that's when